here we go. A Fox News alert. It's been just 2 years since Angelina Jolie had a double mastectomy to reduce her chances of getting cancer, based on her family history.
And now the Hollywood star announcing that she's had her ovaries removed after early signs of the disease. So was this a good decision? Let's ask Fox News Medical A-Team's Dr. David Samadi. So she had this history of cancer in her family, starting with her mother, right? She did a BRCA analysis to determine what her risk was.
Yeah, so this is, first of all, I commend her for what she's done. She's followed everything that we've talked about in this show for many, many years. Know your risks. So she went, and based on the family history, mom, grandmother, and aunt had the breast cancer. She got the BRCA1, and she ended up having that marker. So that gives you 87% chance of breast cancer and 50% chance of ovarian cancer. She heads on and did the mastectomy in order to reduce the risk of breast cancer. At some point, she also got the tumor markers, which is a CA125, for ovarian cancer. Fortunately, that was normal. She got the X-rays, PET scans, and CAT scans. That was normal. She went ahead and she had a laparoscopic removal of her ovaries because of the high risk of getting ovarian cancer. And there was a benign tumor in those ovaries. She's cancer-free. This laparoscopic removal of ovary is actually a simple test. There's no incision, and she's going through her recovery. So this is a great example for America to understand that screening saves lives.
So you're saying that she didn't have really the choice after the mastectomy to go do this right away. She did a follow-up test that resulted in this, and she made this decision.
Exactly right. Obviously, the risk of breast cancer was much higher, 87%, so that's more cosmetic. Removal of ovaries involves hormones, and she's going to be in menopause, and she's going to be taking more hormones as a result of it. So that was a bigger decision, but she made the right decision for her family and herself.
That can have a big impact on a woman's life, especially, you know, a young woman like Angelina Jolie, like you said, with a breast cancer and you know, risk, and then you do the double mastectomy. That's just removing physical tissue versus having a hormonal impact.
But you know what the bigger message is over here? There's a lot of confusion going on in this country. Should I go for a screening or not? Medical doctors may say, like, yes, you should or not. There are a lot of guidelines coming down the pipelines. U.S. task force would say, like, yes, do it this year. The next year they say, don't do it for many reasons. And things are changing. So people are confused. I commend what she did. She went for a screening. She got the test. She got multiple consultations. She did everything a woman, and also an example for a lot of men out there. Remember, Steve, we talked about this Samadi challenge about 6 months ago. What did we say? Let's put a screen up about this thing. PSA for men and mammogram for women are the same thing. Learn your risk. This is what we talked about 6 months ago on this couch. Improve your quality of life once you know what your risks are and understand, which is exactly what you said about BRCA1. Get screened. This is where the huge problem with the government. Should we get screened or not?
Because you're not going to pay. The government's not paying for it.
Cost and other things, and overdiagnosis and overtreatment. If you have it, treat it aggressively, which she did. Now, should every woman out there go and take out their breasts and ovaries, and men take out their prostates? Of course not. It's called risk stratification. We look at every individual and we decide. So guidelines are the guidelines, but this society is changing them every day. She did the right thing.
Just real quick, Dr. Samadi, the problem is not everybody has the same access to resources or the funds to pay for extra testing that perhaps your insurance will not cover, which makes it particularly challenging with women's health issues, I think.
That's absolutely the key. I think that also the insurances are a huge problem. There are a lot of foundations that we can use to really save your life. But let me read something about her, which is, we have 2 seconds. It's not easy to make these decisions, but it's possible to take control and tackle head on. This is very important on any health issues. I don't want you to be scared. You can seek advice, learn about the option, and make the choice that's right for you. It's a personal decision. Knowledge is power.
But when someone famous does something like this, it makes your job easier.
I love to meet her. I love to get Brad Pitt involved. Go to #Samadi Challenge. #Samadi Challenge. Post your pictures about survival. We have people in this studio that have ovarian cancer. We want to save your life. She's a good example for women and men. And we
want to save our men, too, so get your PSA tested
so Brad,
as well.
tweet us, okay?
Everything. We're going to post everything on SamadiMD.com today with a lot of more detail. And thank you for bringing this to the surface.
Thank you for being here, Dr. Samadi.
All right, Dr. Samadi, thanks.